Our goal is to help everybody reach their maximum potential. I had a client come in and she had MS, and basically the idea behind it was, unfortunately that's a thing that's degenerative. So, you're kind of slowly, progressively getting worse. And so the idea behind it was, when I sat down and talked to her, I basically made this statement, I'm not a physical therapist, I'm a trainer. So when you come to me, I'm going to train you. And the idea behind it is I'm going to make you stronger, and I'm going to work with you for whatever goals you want to accomplish. And so the idea behind it was, I said, but now that's my role in it. Now your role in it is you have to picture yourself as an athlete, and you have to picture yourself coming here to train. So the idea behind it is you can't identify yourself and put yourself in a category. You have to look at it and say, what is my potential and what are my goals, and I'm going to work to make those changes. And I'm here to help her do those things. So the idea behind it really was to get her to think of herself as an athlete, and to get her to think that she could make herself stronger, and to get her to think that she could make positive changes in herself. That her body wasn't just degenerating and getting worse, that she can actually stop that pattern. And so that was basically the philosophy behind it.
The one thing that I really liked is that the goals that were set were not unattainable, because that's very discouraging when you think that you're supposed to attain a certain level and it seems so far away, and it's discouraging. So when the goals were set, they were attainable, and then when I reached those goals, then we set more goals. So I liked the way that was done.
I had a client come to me, and basically, fortunately I knew him a little socially, and I went to church with him, and so I knew a little bit about his past and his history and stuff, and he had a really bad back issues. And at that point, basically the concept was, there wasn't really a lot they could do with surgery. There was some experimental things that he could maybe possibly do, but there really wasn't anything that was, very positive for making any changes. And so when he came to me, he was pretty, he was at a point where he was just this crossroads. He didn't really know where to go and really how to make a change. So basically I told him, I said, just train with me for a month or two, see if it can make a difference, and then we'll just go from there. And so my idea behind that was basically to get him stronger and to stabilize his back. So because he had so many back issues, the idea behind it was, if I can get those muscles stronger, that will stabilize. Because if you look at a back, all the muscles are crossing in every direction, and they're all set up to create motion, but they're also set up to stabilize your spine too. And so the idea was, if all the muscles that stabilize your spine, if I can get them stronger, they'll hold that spine better, there'll be less kind of motion in there, and he'll control it more. The other part is that when you have an injury, there's a sense that when your body has an injury, it either over tightens a muscle, which most people watching this will realize when you have any lower back issues that those muscles in your low back kind of lock up and tighten and you almost can't even move. And then there's also muscles that kind of shut off. There's points where they just don't really engage at all, and you feel like a weakness towards them. So the program really is to get those muscles that are over engaged, that are tightening up all the time, to relax and calm down, and then the ones that aren't engaged to kind of like turn that switch and turn them on and get them to fire.
And the body wants to compensate for the pain. So there's pain directly in the spine. So the muscles try to realign the spine to get it in a position where it's not in pain. So the muscle on one side pulls and it still doesn't relieve the pain. So another muscle pulls. Right. Next thing you know, they're doing a muscle dance and spasming, trying to relieve the pain. Right. Well, that goes on, and then you take muscle relaxants to try to quiet them down. They're limited benefit, but they can help. Mm-hmm. But after day, and week after week, and month after month of these muscles trying to correct a situation that they can't correct on their own, some of them start to shut down. So what had happened in that original test, the lower erectors had stopped firing. He figured out somehow the lower erectors weren't firing at all. I couldn't get them to engage. Right. And then after, I don't know, a few weeks or a few months of training, gradually the erectors started to engage to the point where I can feel them engage now when I do the exercises. I can tell when they're working. Occasionally, as we go through the weeks, one side will stop for a day, and then we'll get it fired up again. And so I think it took a while. I'd say it took like a year. And then I could see some improvement along the way, even in that year, but it was very small and incremental. But we got there.
You did.
Multiple things going on. He already had a heart attack and he had bypasses done, so he went through the open heart surgery. He had, the prostate cancer, so he had to go through that surgery. And so, so when Dave came to me, there were specific things that he's already gone through, but there was also specific things that he had to address. Now, one thing with bypasses are typically, the recommendation is they have 10 years or somewhere roughly around there where they kind of guarantee them. And then after that point, your lifestyle becomes a major factor on whether you maintain those or you recreate a problem again.
They push the dye in and they trace your heart, and he goes, I heard him say, "Oh my." It's like it's not what you want to hear your cardiologist say when they're doing a test. I was almost 100% blocked. They call it the widowmaker. It was with a right coronary blocked like that. But what happened though was after 10 years, which was 2006 for me, I kept getting better and better. My cholesterol was coming down between the exercise, the diet, omega-3s, statin drugs, obviously. My wife said later, the cardiologist came out to her and said, whatever he's doing, tell him to keep doing it because his bypasses are pristine. That was a direct quote. Now, cardiologists don't usually say that kind of stuff. They don't usually use terms like pristine or whatever, but he said that tell him to keep doing it because his bypasses are wide open. And then I got the report later, and you go through all the technical mumbo jumbo. Basically, they were free, they were clear, and it was all really a benefit of the lifestyle, the exercise, getting rid of alcohol in my life, getting rid of the sugars, getting balanced with supplements, and really doing the level of training.
A few years ago, I had a diagnosis. I've always, since I was younger, probably maybe my early teens, I found out that I had a valve issue, and at that time they'd said it was a bicuspid valve that we found out actually at one point it's like a unicuspid valve. You just get checked every 5 years or so and make sure that nothing's changed. Now, unfortunately, a couple years ago, I found out there was a significant change. There was major calcification to that valve, and the valve wasn't functioning at all. And so I went in, got the test. They told me what was going on out to a certain degree. Now, I've had people in the past that have had that surgery, and I helped them through it. So for me, the knowledge base of knowing what the surgery was about, knowing what it entails, knowing you're recovering, and knowing how to recover from it, I've already have. And so I was very prepared for that. And I think that actually made the process really, made it a lot easier for me. Now, it's probably I'm almost 2 years out and have no limitations. I exercise exactly the way I did in the past.